Life on the front line. Many of our healthcare workers battling COVID-19 in our hospitals for nearly a year now. A Valley ICU nurse telling us conditions now are as bad as they have been. And he's talking with ABC 15's Mike Pelton.
Well, this is something I've heard from healthcare workers in recent weeks, battling yet another surge, working long hours and seeing a lot of bad outcomes. A nurse I talked to today says he's tired.
We're exhausted, man. We're exhausted.
Eddie De La Torre is an ICU nurse at a Valley hospital.
Continuing to get worse and worse. The biggest issue is surrounding staffing. Staffing in a sense that with the amount of patients that are in the hospital, we're finding it harder and harder to find ways to provide each patient a nurse in the safest manner possible.
And ICU beds are a limited resource.
It varies just because the way movement works in the hospital. Someone can get better, someone can get worse. Some people pass away. So I can tell you that there's few.
As for COVID patients,
what's the sense of those who may be able to talk?
So, here's the thing. I wish I can tell you that I've been able to talk to a COVID patient, but the last few times I've worked on that unit, all my patients have been intubated, and the majority of the patients in the ICU are intubated and really sick.
And the outlook isn't good. On Wednesday, the head of ASU's Biodesign Institute saying this surge may not peak until late January or early February.
I hope they're wrong, but if that is the case, then we're going to be in for a rude awakening, because that's going to be bad, because right now is horrible.
With visitor restrictions, Eddie notes the patients, COVID and non-COVID, left to find family support over an iPad.
It's horrible. The tears are back. The tears are back, and it doesn't seem like they're going anywhere.
For Eddie, it's back to work on Thursday. Mike Pelton, ABC 15, Arizona.